So welcome everyone to the May 2024 session of Community Health Learning Collective, also known as CHLC. If you are new to this group, we are just a virtual shared learning space for community health workers, promotoras de salud, CHRs, people who work in outreach, allies who support the work of community health workers. So basically, we get together once a month over Zoom. My name is Maureen Burns, and I and my colleague Candace Draw, we both work for the HAP Foundation, which is located in Chicago, Illinois, and we also facilitate this group. So all are welcome, whether you're local to Chicago, Illinois, or from a different state. And basically, we just like to get together, learn from one another, share updates, and then also learn from great speakers who come and give workshops for us. So today for our May session, we're really excited to welcome David Bishop, who is an LCSW. He is a sleep apnea patient and the founder and CEO of Sleep Equity Project, which is a nonprofit focused on helping underserved people get healthy sleep regardless of their socioeconomic status, geographical location, or gender identity. So I'm really excited to hear from David today because I feel like we do not talk enough about the power, the importance of sleep, and all that goes into that. So join me in welcoming David. David, please take it away.
Thank you, Maureen. Hello, everybody. I'm going to share my screen. Can everybody see my screen?
Yes, we can see it.
Thank you. So first, I'd like to thank Candace, Maureen, and CHLC for inviting me to present today and for the HAP Foundation for hosting. As Maureen said, I'm a sleep apnea patient. I have severe sleep apnea, and I founded this Sleep Equity Project in 2023, last year, after I saw a huge gap in patient advocacy solely focused on minorities, women, children, and older adults in the sleep space. And as Maureen said, our vision is to make the health benefit of high quality sleep equally accessible to all individuals, families, communities, regardless of where they live, their socioeconomic status, and their gender identity. And so you may think that having that kind of vision is kind of something that is already there. People are able to get high quality sleep regardless of where they live, but in fact, research shows that your zip code will dictate all kinds of things. And as you well know, as community health workers, the socioeconomic challenges and the social determinants of health, really impact how people are able to access health services, how they're able to afford healthcare services, and the quality of healthcare services. So the benefit of healthy sleep is something that is not attainable for people who are also impacted by the social determinants of health. And so my vision really is to make that health benefit equally accessible to all people. And before we get started, I'd like to invite anyone to put any specific questions you have in the chat. And if Maureen and Candace, if you could monitor that, if you have any thoughts about sleep, regarding your clients, or you have thoughts about sleep regarding yourselves. So the learning objectives we have today, we're going to discuss how does stress impact sleep? What is there about stress that really interrupts our sleep? And we all get stressed. It's something that nobody is immune from getting. So we want to talk about that and how that actually works. And then also, how much sleep do we really need? Everybody has their opinions about how much sleep we really need. And the researchers, the scientists, and the sleep physicians, they have their thoughts about how much sleep we really need. And actually, it really is very connected to the development of diseases. And then we'll talk about sleep and diseases. We'll talk about, what are some of the things that have been found to be associated with poor sleep or insufficient sleep. And then we'll dive more specifically into insufficient sleep and what does that look like across the country. I know we have some folks here from different parts of the country, so you'll get a chance to look at what the research is saying about sleep across the country. And then a really important area that we'll look at is quantity and quality. So insufficient sleep would fall under quantity, but we're going to talk about quality and see, what that looks like. And then we'll talk about the circadian clock. And, this may be information that you guys have already heard or that you're really, well versed on, but I think it merits, us revisiting that discussion about the circadian clock in the body. And then we'll talk about sleep medicine, what sleep medicine can do. And then we'll cover sleep disorders. And then we'll talk about what you guys can do to help your clients. So, which animal here do you think is the most stressed? Any thoughts?
Okay, now I have to be transparent for a second. Every time I see lions and tigers, especially at the zoo, they just chilling. So I'm gonna say zebra.
The zebra. Okay. All right. So imagine you're the zebra, and actually the answer is both animals are stressed. The lioness is stressed because she has to get up all that energy to, really hunt those zebras down and, make that kill. They have to feed the pride. And the zebras are stressed because they have to get away. So imagine they're a group of lionesses. Sorry, I didn't mute my house phone. Imagine there's a group of lionesses and they're hunting and you're the zebra, right? We can much more readily imagine being zebras and how stressed they would be in this situation. And you're wanting to live another day, right? And your cortisol hormone is sky high, your heart rate is sky high, your muscles are at max performance. You need to marshal everything that you have in order to get out of this situation. Because this group of lionesses, they're working together to strategically hunt down their prey and feed the pride. So they're at an advantage here. And maybe you make it, and maybe you don't. Either way, you will have to run like you've never run before. Well, this is what's called the fight or flight mode. And obviously, with a group of lionesses, they're going to probably prevail, and that the lionesses are going to continue on until they can, get their prey. But the typical hunt will last about 3 minutes, right? So these zebras have to marshal all of their energy. They have to get out of this situation, and that fight or flight is going to last for 3 minutes. So that is an example of acute stress, right? Once those zebras reach the safety, their cortisol levels are going to go down. They don't think about the next time they get into this situation. They don't lay awake at night really thinking about the next day or the next time they're going to be in a situation with the lioness. They aren't retaining that information. Their stress level goes way down. So Robert Sapolsky is a distinguished American biologist, neuroscientist, and primatologist known for his extensive research on stress and its effects on health. And he wrote a book called Why Zebras Don't Get Ulcers. And it's not a book about zebras, but it's really about stress and how the brain and body and overall health are affected. And he offers solutions, and he writes in a really nice way that's accessible to the general public. So I highly recommend this book. It's a really good read. I have it. And what he's able to do is really to break down this stress response and to help us to understand how it impacts us. So this is one of the ways that stress can contribute to interrupting or developing diseases. The other thing that it does, of course, who can sleep while they're stressed? If you're at the max level where you're so stressed out, I think sleep is probably the first thing that's going to be impacted. So Sapolsky really was really good in terms of understanding and describing what's called anticipatory stress. So we turn that stress response on purely for psychological reasons, that we're anticipating something's going to happen. And really, this system, that fight or flight system that we have, it didn't evolve for dealing with long-term stress. It evolved for dealing with short-term stress. That's why you can see it in animals who are animals of not animals of prey, or you see it in all animals, but that's why he was able to study it. And in his book, he discusses that humans are the only species that develop anticipatory stress. We worry again about those future events, and then that in turn has an impact on our brains and our bodies. So that chronic anticipatory stress can contribute to the development of cardiovascular diseases through several mechanisms. Increased blood pressure, where you have persistent stress that can cause consistently elevated blood pressure, which is a major risk factor for heart disease. Elevated cortisol levels, chronic stress leads to a prolonged level of high cortisol, and that can result in inflammation and also insulin resistance, both of which are harmful to our cardiovascular health. And then unhealthy coping behaviors. When we're stressed out, what do we turn to? Comfort food. When we're stressed out, do we feel like we're going to, do something about it right away? Are we going to run around the block? Are we going to go exercise? We're probably
It
more
sure
prone
is.
to just not engage in those kinds of activities. Excuse me. And then smoking. Smoking is also another coping behavior. So these are also risk factors for cardiovascular disease. I apologize for drinking on camera. My voice, I started to get some sinus issues yesterday, so I was stressed out, so it's still with me today. And then autonomic nervous system imbalance. Chronic stress can really lead to that imbalance in the autonomic nervous system, which increases that sympathetic activity, which is where the fight or flight response lie. And it reduces the parasympathetic activity, which is the rest and digest response, further stressing the cardiovascular system. So when that zebra is being hunted by the lioness, they don't have time to rest and digest. They're not going to stop and use the bathroom. They're going to be all out running as fast as they can to get out of that situation. So overall, the chronic activation of a stress response, anticipation of that future event, can really disrupt a person's sleep pattern and increase, as I said, the risk of cardiovascular disease. So stress is also something that is disrupting of our sleep. So you may have heard of the sleep disorder insomnia. Stress and anxiety are a core element of insomnia. And if you have any questions, please, feel free to ask. I can't see the chat because I'm in present mode. So if there are any questions, Maureen or Candace, if you could let me know.
We got you
So we
covered.
have, go ahead. Okay. So we have 90 minutes, guys, and we have plenty of time to discuss your questions and kind of pick this apart. So what are the main pillars of health? As community health workers, you guys can answer this better than me. You've seen the whole spectrum. One of the things that I found was that, of course, nutrition, mental health, relationships, spirituality, exercise. This is just to name a few. I'm sure there's some other ones, but you'll notice in this graphic that the pillar of sleep is kind of eroded. It's short. It's shorter than the other pillars. So sleep, for some reason, has not become a mainstay of the pillars of health. And we can think about notable people in current popular pop culture who are saying that, Elon Musk is one of them, that they don't get a lot of sleep and that they feel like their productivity is hampered if they're sleeping too much. Well, there's also Thomas Edison, who helped invent the light bulb. He was notoriously bad for not letting his employees sleep. He actually would hire people to watch the scientists and the people who were working on experiments to make sure that they didn't fall asleep. So here is somebody who, helped invent the light bulb, and that light bulb really helped us to extend our day, helped us to do more things on the inside. But he also was a napper. He would fall asleep and take naps himself. And what he would do is he would hold an object in his hand, and when he fell asleep, that object would fall out of his hand and hit the floor. So he had some really interesting thoughts about sleep. But there are other people who really have eroded society's view that sleep is a main pillar of health. So let's play a game in the chat. Let's see who can come up with the most phrases for sleep, like I'm sawing logs, or I'll sleep when I'm dead, is one that I've heard. So let's enter some phrases that talk about sleep in the chat. And this is part of kind of a informal study that I'm doing, not a real study, but just a survey of what kinds of things people have heard about sleep. I usually do it in all my presentations, and there have been some really interesting sayings. So let's put that in the chat, and let's see if we can generate some nice phrases, and then we'll come back to that at the end of the presentation. Excuse me. So what is the recommended amount of sleep? And this is a question that comes up very commonly. How much sleep do we really need? And the answer is it really ranges throughout our lifespan. So as you can anticipate, newborns, small children, they need much more sleep than we need. They could sleep up to 14 to 17 hours a day, and that includes naps. Newborns rarely sleep throughout the night. They're up and they're asleep. Other infants need about 12 to 15 hours of sleep. So again, that's that rest and digest and that development where they are really getting the good benefits of sleep. Toddlers, could still be within 11 to 14 hours. So still quite a bit of time sleeping. So I have two kids. They're older now, but they slept a lot, and when they slept, I slept. So it was good for them, and it was good for me. And then children in those preschool years, they're still about 9 to 11 hours a night. And then teenagers, right? One of the issues around teenagers are these early school start times across the country, where these schools have teenagers showing up at 7:30, 8 o'clock, 7 o'clock to really start their day. And that's something that the American Academy of Sleep Medicine really is concerned with, because the research is showing that teenagers even need about 8 to 10 hours of sleep a night. So when you have an earlier school has it. They're considering it in their legislature. So there is a movement, and that movement really uh, there is a movement, and that movement really is being made by the sleep physicians and the sleep scientists who are looking at all these studies about what we're able to do with optimal sleep. And then adults between the ages of 18 and 64, we should be getting around 7 to 9 hours of sleep. And then if you're older than 65, you may need a little bit less sleep. 7 to 8 hours is recommended, but as we age, we get less deep sleep. So then we see older adults not being able to get those 7 to 8 hours of sleep. So what do we see when we're able to get a good amount of sleep? Everybody is familiar with the lymphatic system across the body. That's the system that's used to get rid of toxins. And
then you don't send it out.
years ago, scientists didn't understand how the
Maybe I
brain.
can maybe I'll update the flyer. I'll just update the flyer with the date on it, so
Can
that
you
way
please mute
it'll
yourself?
go out the agency so they can prepare to make that.
So for us, if I make the flyer, I'll see sheet on our
Oh,
side because
okay.
To take a drink. So years ago, it was unknown how the brain was able to rid itself of toxins because of the blood-brain barrier. And in 2013, a Danish neuroscientist, Dr. Maiken Nedergaard, discovered the glymphatic system. So the glymphatic system is the process that where the brain rids itself of the waste that builds up during the day. And deep sleep is where this process is most effective. And they've been able to image this process more recently, and it's really fascinating. The brain actually shrinks, and these channels open up and allow the cerebral spinal fluid to wash in and clean the toxins out. And the optimal amount based on this research is that the optimal amount of sleep that's needed in order for this process to happen is 7 hours. So this really has implications for research on Alzheimer's, on dementia, on the quantity of sleep that we're getting. So it's a really interesting process. I encourage people to look at it closer. And, I hope that it also is able to make progress in regards to Alzheimer's and dementia. So let's do a reality check here. If you can put in the chat, how many hours of sleep you got last night. Did anybody get 8 hours of sleep? Did anybody get 5 hours of sleep? I see Maureen says she got 7. Becky says she got 8. That's great. Yeah, let me know. 4 plus 2, Robin said. So she was asleep for 4 hours, and it looks like she woke up. Then she got 2 more. Lou said she got 6 or 7. Scott got 4. 8 hours for Adriana. So that's a great. According to the phone, Elizabeth got 8 hours and 22 minutes. So, the reality check is who can get 8 hours consistently is really difficult. Me, myself, I'm a patient advocate, and I also have researched a lot about sleep. And not last night, but the night before, I got 5 hours of sleep because I was rereading the presentation. I was also watching a basketball game, and I was waiting for my son to get home from work late at night. So, the reality is it's very difficult to get high quality sleep, but the goal is to have consistent high quality sleep. consistently get those 6 to 7 to 8 hours. And so you're going to work your way up to that. If it's something that you have an event that's going on, then you may not get that optimal sleep. But hopefully you're able to get back and do, 6 or 7 or 8 hours. But the reality is that, you may not be able to do that. Maybe there's something that's interfering with your sleep, or maybe something is happening with your clients and they can't sleep because of a whole host of things. That's the reality that we're faced with. So thank you for those answers in the chat.
David, quick question from the chat. Someone
Okay.
brought up, does it have to be straight through, right? They said like they wake up several times in the night. Do you have any thoughts on, does that impact the quality of the sleep?
Yes, and I should qualify that I'm not a sleep scientist or a sleep physician. I'm a sleep patient. But in establishing my nonprofit, I've read a lot of research. I speak to sleep physicians. I pay attention to their recommendations, and what they say is optimal. So this is advice that I've gotten from sleep physicians and listening to numerous presentations. So having if people are waking up multiple times a night, if they are not able to fall back asleep within about 10 to 15 minutes, then that could be considered potentially insomnia if that has occurred for at least 3 months. So if it's something that's just sporadic, then it's probably okay. Maybe there's a medical condition. We work with a lot of clients who have medical conditions that don't allow them to sleep through the night. But ideally, you would want to sleep throughout the night. And interestingly enough, the research says that we all wake up throughout the night. We have our sleep cycles, and at the top of that sleep cycle, we are at the point where we could potentially wake up. But we're not conscious of that. And when you look at the sleep cycles, where sleep physicians look at the patients who are in sleep labs and they looking at their sleep cycles, you'll see that people are almost awake. And it's normal for us to almost wake up, but it's not necessarily healthy if we're up and then we can't go back to sleep. So we'll talk a little bit later about sleep hygiene and some recommendations for sleeping. So thank you for that question. And definitely any other questions, feel free to ask. So we did our survey, and people entered how much time they sleep last night. And one of the things that is really interesting is that if you're still sleeping during the day, then that is potentially problematic. So let's look across the country and see what is actually happening with regards to the amount of time people are sleeping across the country. So the Centers for Disease Control created the Behavioral Risk Factor Surveillance System in 1984, and it asked about a whole host of behaviors, but sleep was included in that. And the surveillance system is really the nation's premier system of health-related telephone surveys that collect data in all 50 states about U.S. residents regarding their health-related risk behaviors, chronic health conditions, and use of preventative services. And they surveyed almost 500,000 adults, as I said, across all 50 states. And what they found is that 1/3 of people are not getting the sufficient amount of sleep. So for those of you who said 5 hours, 6 hours, 4 hours, you're not alone. 1/3 of people are across the country are not getting that recommended 7 to 8 hours of sleep. So one of the things that the Centers for Disease Control found is that the insufficient sleep duration it's been linked with 7 of the 15 leading causes of death in the United States, including cardiovascular disease, cancer, type 2 diabetes, heart disease, depression, motor vehicle crashes, work mistakes, hypertension, depression, and anxiety. So that's something that we would want for our clients to really focus on, and ourselves. What is interfering with our ability to sleep? I'll just preview a little bit. Is it our use of caffeine? Is it the introduction of digital devices in our bedrooms? Do we have a TV in our bedroom? Those are all things that will interfere with our sleep. Do we eat too late? So really, we want to close that gap of our perception that we're getting a lot of sleep versus really the reality that 1/3 of people in the United States are not getting the sufficient amount of sleep. So let's look at what the CDC said about specific states. And really, so I'm in Illinois. I know we have somebody here, I believe, from Washington State. Really, this map shows that that 1/3 of adults really is consistent across the country. And so the worst states for sleep are in the Southeast and also in the Midwest: Ohio, West Virginia, Kentucky, Tennessee, Arkansas, Louisiana, Alabama. But you see that Illinois is a close second. Missouri, Kansas, Texas, Georgia. So really, if we want to sleep well, I guess we need to move to Montana or Washington or Oregon. But this is concerning that we're not getting enough sleep. And this information was really, I'll talk. Really, this information was taken from a study over 10 years. And so it wasn't anything that they just measured in one snapshot. They really saw sleep worsening over time, over a 10-year period. So it's something that should be of concern to you, for your clients. It's something that I would recommend that we look at much more closely. And I see a question: what do they use to measure that with? And what they're looking at is that brief survey of people reporting sleep issues, the amount of time they sleep, their use of caffeine. They're collecting all of this data, and actually, what they're looking at, they're using the basis for the CDC statement that really insufficient sleep is a public health issue. They put that out in 2014. They used the National Health Interview Survey, the Behavioral Risk Factor Surveillance System, the Youth Risk Behavior Surveillance System, and the American Time Use Survey. So they really pulled data from a lot of different systems to come up with this information. And it's a pretty rich amount of data that they were able to collect. So it's really nice that they included sleep. There were some years that they did not include sleep in there, so we're missing that data. But overall, it's really nice that they're able to include sleep and give us a snapshot of what's happening across the country. And then there's a question in chat about why these regions are the highest. So in looking at the information, obesity involves the development of chronic health conditions, but it also impacts our sleep. Also nutrition. I think also issues in regards to socioeconomic status. uh, are impacting, these rates. So, multiple factors. And when we look at social determinants of health, there is no one specific factor that really is takes over to impact something. There are numerous factors that really come to play. And that's why it's really important for us to have multiple levels of interventions. Those interventions that are focused on, the neighborhood, it's focused on the individual and the family, it's focused on the community, it's focused at a city level, focused at a societal level. So that is, that's really how something is going to be addressed. There's a comment that the person hates when they wake up early on these days, and that they're not able to sleep in. So, when you look at, people who do shift work, and they're having problems with their sleep-wake cycle because they have to wake up at night and sleep during the day, it can be really disruptive. But for the comment in the chat, we have different what's called sleep chronotypes. Some people are early risers. Some people are able to stay up late, go to sleep, and then function normally. So, sometimes when we have to consistently get up early, if we're not matched with our sleep chronotype, then that can be problematic for us. It could cause us to use, more stimulants to stay awake during the day. So those are really interesting issues to deal with. There's a comment, the self-report, people might report more sleep than they actually get. It could be even worse. And that's something that they do talk about, that people may not, they may, that perception versus reality, their perception is that they're getting good sleep. And the reality is, they may be not sleeping consistently through the night. A bed partner may see their bed partner snoring and stop breathing and choking. That's what my spouse saw, where I was not breathing and I was choking. So even though I felt like I slept 7 hours that night, prior to being diagnosed with sleep apnea, I was not getting quality sleep and was not getting the quantity that I needed. So just try to make sure I cover everything in the chat. Yeah, thank you everybody for the comments in the chat. Someone said they wake up at 6:30 a.m. and cannot sleep after that. Is it normal? Well, our bodies naturally have melatonin, and melatonin is what helps us fall asleep at night. And so when we sleep, we are that melatonin level goes down, and the chemical that helps us stay awake goes up. So that's something that naturally happens in everybody. So if you're saying you wake up at 6 and then you can't sleep after that, the question really is, do you feel like you got a sufficient amount of sleep? And are you taking multiple naps throughout the day because you're still tired? So it is an instance where you have to determine, are you tired during the day? And the interesting thing about how people report being tired, the sleep researchers and sleep physicians are finding that women report being tired in a different manner than men do. Men will talk about exhaustion. Women will talk about fatigue and issues with mood and headaches. And so women just based on the research are not going to, talk about that extreme of being tired. This is one of the factors that causes women to be tremendously underdiagnosed with sleep disorders. So they're missed by their primary care physicians, they're missed by sleep physicians because that reporting is such that they are not saying that they are just completely exhausted. So again, the question is, if you wake at 6:30 and you're able to get through your day without excessive amounts of caffeine, and naps, then that probably is not a problem there. So now we're going to turn to sleep and different chronic health conditions. So the research is showing that with insufficient sleep, it can lead to glucose issues with glucose and insulin levels, which could increase the risk of the development of diabetes. And these studies are based on large samples of subjects, and the findings are very clear. So when you're thinking about working with your clients, you also want to think about how their sleep is impacting chronic diseases. So now let's talk about sleep duration and cardiovascular disease. Inadequate sleep really has become very pervasive, and its impact on health and the quality of life really remains to be fully understood. But too little sleep or too much sleep has been shown to be an independent risk factor for the development of cardiovascular disease. So both extremes, those people who sleep too little and those people who sleep too much, are at risk for an increase in prevalence of cardiovascular diseases, which include hypertension, coronary heart disease, and stroke. So when you look at the extremes, if somebody is not able to sleep for 6 or 7 hours, then you want to talk to them about, maybe their sleep hygiene, or talk to them about things that could be problematic for them, that they aren't able to get good sleep. And we also want to remember that, because of the social determinants of health, there may be bigger issues that they're facing that may not be easily resolved with just sleep hygiene. That's one of the things we have to consider, and working with our clients. Always consider the various elements that are involved. And when you think about the advice that's given by sleep medicine, one solution may not be a really effective solution for other groups who may have different challenges. So that's what we have to consider when we're working with our clients. So we've talked about disease development. We've talked about stress and how that helps impact the development of disease. We've talked about insufficient sleep. Now let's talk about not getting enough sleep. Is it quality or is it quantity? Which is more important? And the answer is both. Both are equally as important. So the quality of our sleep is very important. And when you look at patients who are in hospitals or nursing homes, they're frequently interrupted to do blood draws. The doctors are making rounds. The mealtime is happening, 3 times a day. So it's really not an environment where people can really get good rest. And so a term was coined recently by Dr. Galit Dunitz and colleagues that described sleep insecurity, and it was defined as the limited or uncertain ability of adequate sleep in various environments. So this is something, it's a fairly new term, but it really describes that issue where we feel like we can get some good sleep in a hospital, but it turns out, I've heard people say, I can't wait to get out of the hospital so I can really get some good rest. And care is the priority in hospitals, and the priority is not for the patient to get restful sleep. And then also we have to consider patients who are not ambulatory, those who can't walk. Those patients potentially cannot get access to sunlight, which may interfere with their circadian rhythms, which we'll talk about in a few minutes. So those patients who aren't able to go get that good sunlight like we're able to do could have issues with their sleep. Where else do you think that there is sleep insecurity? Maybe we can come up with a couple more to kind of expand this definition, in your work as community health workers, you may think that there are other environments where there's sleep insecurity. And why is it important to talk about sleep insecurity? Really, when we think about all these systems, as I said before, we kind of take it for granted that people are able to get good rest. But based on the environments, they could be have sleep insecurity. So now let's talk about another term that was recently coined, sleep deserts. Sleep deserts was coined by Dr. Harire Atarian and colleagues, and it's a term that refers to neighborhoods that are not conducive to sleep. An example of that would be areas with high crime, housing stock that is poorly planned and built very close together, excessive noise, light and air pollution. All those things affect the quality of our sleep. And, it's very easy to take for granted that this is something that's a given, that, these factors are not going to interfere with our sleep. But in areas that are socioeconomically challenged or maybe have been ignored by the government, they're having issues with these factors, and, people are not getting restful sleep. So sleep deserts is a term that really is a very interesting concept. I can think of different parts of where I live where there are no sleep clinics, and the sleep clinics really are found in very large institutions. And, we turn to our health information, we turn to, support hopefully in our neighborhood. But if we have to go outside of our neighborhood to get that support, then that's a barrier. So with regard to sleep services, there are some neighborhoods across the United States that those barriers really are problematic, and they're sleep deserts in essence. So keep that in mind for some of your clients, that it may not be as simple to access sleep care services. So now let's talk about the circadian clock. And this slide is very busy. When I put it together, I looked at it and I tried to revise it, but this information is just so really very impactful to every single human being on Earth, that I think it's really important information. So the circadian clock, that is something that was discovered first back in 1729 by an astronomer, who discovered a plant opened its leaves in the morning and closed them at night. And so that was the first notation of something that was living that really reacted to the sun and then changed when it was nighttime. And in 1938, researchers at the University of Chicago went into a cave and actually established the presence of their circadian rhythm in humans. And so here you have this science starting to advance and be documented in a very methodical way. And then in 1972, the master body clock was found in humans, and that's called the SCN, suprachiasmatic nucleus. And it's something that's actually located right above the eyes in the brain. And it's a really very fascinating finding because it reacts to sunlight. So when you hear people give advice about going out to get sunlight, that master clock in our body in our brain is really reacting to the light dark cycle. And then in 2017, the Nobel Prize was won by Hall, Robash, and Young. And it was a really crucial finding because what they found is that our internal clocks, really, when they're out of sync, they put us more at risk for various diseases. And so your circadian rhythm really has an impact on our well-being, on our behavior, and our energy, literally every second of our lives. And they're actually circadian clocks in our different organs across our bodies. So the master clock is syncing up with the clocks in the various organs. So this is really a major finding, and the circadian science really is very robust now. So when you look at sleep science, they have sleep medicine, and then they have circadian science. So we really hope to learn more about circadian clocks and how that helps us both get aligned and really work on preventing the development of diseases. So in 1970, the first sleep clinic was established at Stanford University. And, there you had the discovery and of the ability to test someone to be able to determine their sleep cycle. So Stanford University was the first to really bring this into a laboratory setting and really study people and figure out, what's happening for somebody's sleep. But sleep medicine really only started as a subspecialty in 2003. So in comparison to all the other medical specialties, sleep medicine is fairly young. But in the time that they first started, there are over 80 sleep disorders that have been discovered. And there is an earlier mentioning, really in the 1800s in regards to different sleep disorders. But at this point, we have 80 different sleep disorders. And insomnia is the number one in terms of prevalence, and sleep apnea is number two in terms of prevalence. A little bit more about sleep apnea. Over 1 billion people are estimated to have sleep apnea worldwide, and only 20% of them are diagnosed. So 80% of people suspected to have sleep apnea across the world are undiagnosed. So for somebody who's a patient advocate who also has sleep apnea, I'm very passionate about that. And, that's one of the reasons why I wanted to establish my nonprofit, is to really focus on helping people become more aware of sleep disorders, get properly diagnosed and properly treated, and also adjusted to the treatment. So major progress has really been made on numerous sleep disorders. Minorities, children, older adults, and women are grossly underdiagnosed, as I mentioned earlier, for sleep disorders. So there are a number of reasons why this is the case. I talked earlier about women describing their fatigue differently than men, and that being part of the reason why they're underdiagnosed. There are other reasons why these groups are underdiagnosed. And some of it has to do with, access to information in terms of the awareness. Some of it also has to do with the primary care physicians. When physicians go through medical school, they get, a small sampling of a variety of different issues and illnesses. And the research has shown that in medical school, sleep is only about 3 to 4 hours, if that, in medical school. And so primary care physicians end up graduating and choosing their specialty. And they, at that point, are really not as up to date on sleep as they should be. They have a lot of different things to pay attention to. And, primary care physicians, maybe are not able to really fully assess an issue in regards to sleep as much as they could. Sleep medicine is, as I said, a subspecialty. They're able to do a very in-depth assessment of someone's sleep issues and make recommendations. And so there are also sleep psychologists who treat insomnia. And a number of the different sleep disorders require medications. So that would then be, provided by the sleep physician. So the field of sleep medicine has made tremendous advances in terms of being able to treat the wide variety of sleep disorders. There are some sleep disorders that have no treatment, and it's something that remains very difficult for those who are affected by that. We'll cover one sleep disorder in a few minutes that's very difficult to treat. So we've talked about quality, we've talked about quantity, and sleep disorders impact both quality and quantity. And as we go back to the slide where we talk about insufficient sleep and the CDC findings, too little sleep or poor sleep has a very firm connection to disease development. So really, when you're interacting with your clients, when you're talking to them about the specific issue that you're focused on, I want you to think about the quality and the quantity of your client's sleep, and consider asking them about that, and consider really trying to help them understand how to speak with their physician about their sleep. So, in talking about chronic disease and sleep disorders, there are obviously, since I have sleep apnea, I've read the most about that condition, and so I'll talk about that. So research is showing that sleep apnea has a connection to a host of different chronic conditions. And so the research has not been able to show causation, but they have shown a prevalence. And so these are occurring either one is occurring first and the other one comes after, or vice versa, but they have a high prevalence. So a 2024 study found that patients with sleep apnea have a 40% higher risk of developing glaucoma. And that's pretty significant. So when you think about your people who are having issues with eyesight, and they may have glaucoma, you may want to think about, how they're sleeping. Are they snoring? Does a bed partner see them stop breathing at night? And it may be something where you're able to help facilitate a more in-depth assessment by the physician and a sleep physician to look at whether or not they may have sleep apnea. And then in regards to hypertension, in fact, more than 70% of patients with hypertension, medication-resistant hypertension, or refractory hypertension, 90% of those patients may have sleep apnea. So medication-resistant hypertension is where the patient has tried at least 3 medications, and refractory hypertension is where they've tried 5 medications. So the research is showing that as much as 90% of the patients with refractory hypertension were found to have sleep apnea. And obviously these studies, there are various studies that look at this issue, and you may have a range of percentages. So in this one particular study that I looked at, the patient population, 90% of them did indeed have sleep apnea. And so when we look at something with regard to women, a 2019 meta-analysis, which is a study of studies, looked at women with polycystic ovarian syndrome, and it found that 35% of women with polycystic ovarian syndrome have obstructive sleep apnea. So when you combine the issue with women being underdiagnosed, and you have a chronic medical condition like polycystic ovarian syndrome, this is a group that is very overlooked. And I would hope that there would be progress made, but I think there's still a long road to go in regards to women with sleep disorders. In terms of diabetes, studies have found that the prevalence of sleep apnea in people with type 2 diabetes ranges from 18% to 86%, depending on the study and the age and obesity of the patients. So, looking across various chronic health conditions, sleep apnea has a very pronounced presence amongst those disorders. And so it's very difficult for a client if they have one major chronic disorder And then adding a second disorder, I'm sure is very, very difficult. But again, when you're working with your clients, you as a community health worker may be the one who's in their home, you see that they're struggling, and bringing up their sleep and any potential issues may be a dimension that either the client has not brought up to their doctor or the doctor has not thought about asking about. So again, just to really just to focus on sleep apnea, these conditions and more have a very pronounced presence. So now let's talk about what we can do about some sleep issues. Earlier on, some of the participants on this call were talking about specific issues in regards to being able to sleep through the night or waking up early and not being able to go back to sleep. So, these recommendations are something that is it's not a one size fits all, but these are just the general recommendations. And really, you can see some of this information here is really coming from all the studies that have been done in circadian science when it talks about the body temperature and the light exposure. So the first one is, get regular sleep. Go to bed at the same time and wake up at the same time, including on the weekends and days off. So it's really important for the body to be synced with a regular sleep schedule. We talked earlier about chronotypes, and some people are just early risers. Some people are able to stay up late and sleep not that many hours maybe, and then bounce back. So, maybe you are going against your chronotype, and if you explore that a little bit more, maybe you're able to really get more restful sleep. The second recommendation is to limit screen time. Set your devices to night mode after sunset to reduce that blue light exposure. So again, we talk about the master circadian clocks in our brains is very sensitive to light. And that science is really very, very good science. So you want to limit your light exposure or limit your screen time during the evening. Also, limiting caffeine. The caffeine has to metabolize through our system. And so sleep medicine physicians and scientists recommend avoiding caffeine late in the afternoon and evening, especially if you're sensitive even to small amounts. So limiting caffeine, be mindful of what you're taking in. The thing about caffeine is that, and also alcohol late at night, it has to metabolize. And so while you may not realize that it's impacting your sleep, it is definitely impacting your sleep. It has to metabolize through our system. The next thing is limiting meals. Avoid large meals within a couple hours of bedtime. So earlier on, I talked about the zebra who was escaping the lioness, right? And so our time to sleep is to rest and digest. But if you have a large meal, then your body is going to be busy digesting that meal late at night. And so you may have, acid reflux or, something that didn't sit right. But it's definitely going to be something that can interfere with getting a restful night's sleep. The next recommendation is to, keep your room cool, dark, and quiet. So that means if you have a TV in your room, it's recommended that you remove that TV. If your room is not, one where you can make it completely dark, then maybe you can change the curtains to make it a little darker. But try to limit excess sunlight or excess light, even in the afternoon as you're starting to wind down. There's some people who are very attuned to technology, and they even will change out their light bulbs in their room so that it starts to dim, or it has a different color that's a little bit more conducive to the brain not taking in too much light. So there are different techniques that some people use to really, set that tone for the bedroom to be to have not as much light exposure. And then set the thermostat to 65 to 68 degrees Fahrenheit. So the body is very sensitive in regards to sleep to temperature. So you want to make sure you don't have a high temperature in your room. So cool, dark, and quiet. The next recommendation is to relax before bedtime. So if you're really focused on exercising and the only time you can get that in is the evening, that's something that you might want to consider not doing right before you go to bed. It is not recommended that you exercise right before you go to bed. Maybe you do it when you come home from work, but use that time before bed to relax. It's a wind down period, for both your brain and your body. And then the last recommendation is to limit naps. You want to keep your naps to no more than 1 hour and avoid napping during the late in the day. When people nap multiple times, it cuts into their total sleep time in the evening. So that sleep drive that we're building up during the day, that really peaks right before we go to bed. Our bodies are ready to go to sleep. If you're taking multiple naps, that cuts into that sleep drive, and you may wake up later in the evening or early morning because you've already napped multiple times throughout the day. So these are just some recommendations for sleep hygiene. Certainly, as I said, no one size fits all. And, the reality check is that, sometimes we're not able to do this, but as much as possible, try to work on these sleep hygiene habits. So there is a sleep disorder called shift work disorder. And, obviously the name is pretty self-explanatory. It's where people who are have to work shifts are not able to sleep during the nighttime hours. And so how is a shift work disorder treated? There's no cure for shift work sleep disorder, but there are several treatments that really target these core features that make up the shift work sleep disorder. So, what the sleep physicians and sleep scientists are saying is that circadian misalignment. So that's what I was talking about maybe somebody's a morning person, but they have to work. And so their circadian alignment is totally thrown off. They're sleepy throughout the time that they're working. The main forms of treatment for shift work sleep disorder are changes to your work routine or your schedule if possible. I've heard sleep physicians talk about this, and the reality is some people don't have an opportunity to go out and just get a different job. Some people who are working shift work, working those jobs because they have to, right? So other recommendations people can do is to change the sleep routine at home. They can use blue light therapy to, help them kind of align things with their sleep. They can do a melatonin supplement, although I would caution people, I'll talk about this in a few minutes. The American Academy of Sleep Medicine has put out a warning in regards to people overusing melatonin supplements. So that's something that you want to be very careful of. Another approach is sleep medications. And again, these recommendations, they come from the sleep medicine field, but you want to be careful. You want to have that prescribed by a sleep physician and not a primary care physician. The sleep physician is more prepared to work with you in regards to using sleep medications. And then also wake promoting agents, stimulants. So shift work disorder is a very difficult to treat, and there is no cure for it. And I know for some of the clients we may serve, they may be working shift work, and they may actually have a shift work sleep disorder. So, as I said, the American Academy of Sleep Medicine has put out a warning specifically around children and adolescents for excessive melatonin use. And what they want the public to know is that melatonin is not under the FDA's oversight like other over-the-counter or prescription medications. And so, the amount of melatonin that's contained in one brand versus another brand cannot be adequately measured because of that lack of FDA oversight. So you want to be careful about taking melatonin too regularly to address sleep issues. You may want to go see a sleep physician and have a more in-depth conversation about those sleep issues. So be wary of taking melatonin, be wary of taking stimulants or other prescription drugs from a primary care physician. Let the sleep physician use their training and their background and what they've learned and all of the research available to help you figure out, a solution to your sleep issues. So, what can community health workers do overall to help your clients? And we're getting to the end of the presentation, and I really appreciate all the engagement from all of you today. What can a community health worker do? You can discuss the importance of quality sleep and sleep in a sufficient duration. So we talked about that optimal duration being about 7 hours. And if people are not able to, excuse me, if people are not able to get those 7 hours, then you want to try and help them figure out, what are some of the barriers to them getting good sleep. Then you can also help patients think more deeply about advocating for themselves with their physicians, and to pay more attention to their sleep. So that advocacy piece is very important. And oftentimes people may not have the words, or they may not have the ability to describe what they're experiencing, and that might be the barrier that they're having in talking to their primary care physician. So community health workers are helping people advocate for themselves, in many different areas. So this is another area that you can help empower those clients to speak up about their sleep. And then talk about how stress impacts the body. So we talked about in our first few slides, if people are having a lot of issues with stress and it's impacting their sleep, it's something that could go on to be more impactful in terms of developing chronic diseases. So, stress management, therapy, working on, their sleep hygiene, the various strategies that you can, use to really help your clients. And then the last thing is to really help make sleep a full pillar of health. And I think, by allowing me to present to you today is taking a step towards that. And I have no doubt that all of you will take this information and really work to help your clients in regards to sleep. So my last slide is just some resources that you can turn to. The American Academy of Sleep Medicine has a very, very good website, sleepeducation.org. They have plenty of resources for patients, really great information that is very patient-friendly. So I would highly recommend their website. And then the National Sleep Foundation is a group of sleep scientists and sleep researchers, and also sleep physicians, and they have a very, very good website. So that website is theNSF.org. So those are two really good resources to turn to for very credible information that's backed by science and research. I highly recommend them. So with that, I thank you for your participation, and I've really enjoyed speaking with you today. Community health workers are a very, very important group in helping individuals out in the community. You know, you guys are focused on community engagement and engagement with individuals and families. And so I really applaud your role in this very difficult landscape of helping clients navigate and address their issues and their health. You know, our medical system is not the easiest to navigate, and you know, your work is very important. So thank you very much for allowing me to present today, and that's it. That's a very poor ending. I hope you can edit that out. Thank you very much for your time today.